today we're going to do a dental exam on Tia. She's a thoroughbred and she's 14 years old. You probably noticed she's already a little bit sleepy. She's had a bit of sedation and the sedation allows us to fully examine their mouth, have a really good look in there, detect any abnormalities and potentially if she has any sharp points on her teeth, we'll remove them. Horses have teeth that grow continuously throughout their life. So their cheek teeth, which run from sort of down here all the way up to back here, they grow throughout their whole life and can get very sharp because traditionally horses were evolved on really harsh diets, so really tough grasses to chew on. And so because these days mostly they get some chaff, a bit of hay and a nice bit of soft grass, those teeth grow continuously. Yeah, I guess one of the first reasons we want to then look at the horse's teeth is so that they can continue to feed efficiently to avoid weight loss and other problems. The second one, why we want to look at their teeth, is to pick up any abnormalities that might be causing them pain. So they can certainly get teeth growing in abnormal places, they can get dental disease and periodontal disease, the same as dogs and cats, and I guess even people. Alright, so today we're going to go through the dental examination. I'm going to show you inside a horse's mouth and then we'll have a look at Tia's teeth and see how they're going. So we're just rinsing their mouth out to get rid of all the grass and hay that she's been eating this morning before we start the dental exam. So now I've got the dental speculum on Tia and our dental halter. We also have a little light attached in here to have a look in the mouth. So I'm just going to lift up her head to my height so I can see it. And then I'm going to have a good look inside her mouth. So the first thing I'm going to do is have a feel. Good, and just feel along both arcades right at the back of her mouth. So I can feel there's a few sharp points there and I'll show you what they are in a second. So with the dental mirror, which is really long to fit along the inside of the teeth, I can see along the occlusal surface, which is the grinding surface of the horse's teeth, and I can make sure that there's no problems with the roots and also that there's no abnormal teeth that I couldn't feel. So sometimes in horse's mouth, what you can see is different to what you can feel, and what you can feel is different to what you can see. So that's why it's important to always do both. Now that I've had a really good look in her mouth, it's time to start correcting some of the problems that I've found. So she has some sharp points, and she also has a little hook right at the front here. So I'm going to sort those ones out now. Okay. So to do that, we use the power floats. So the aim of the power floats is that we can remove tooth nice and quickly to minimise the amount of time we need to have a horse sedated for and also focus on one individual tooth at a time. So it is a little bit noisy, so I'm just going to put in my earplugs and protect my eyes. So I'll do that now. So now that I've used the power float to remove some of the sharp points that occur because the teeth grow continuously, I can have a feel along there and that's all nice and smooth now. So on the edges, that means she's not going to get any cheek ulcers or tongue ulcers and not have any pain in her mouth while she's chewing, while she's being ridden or anything like that. And hopefully keep a good body condition score in these tough, dry conditions. So now that Tia's had her annual dental checkup, it's time to check up on a couple of other things. So other things we can do while they're sedated, we can check their legs, we can take x-rays if we need to, if they have foot problems and things like that. We can take a sample of their poo and look for worm eggs to make sure they don't need drenching or anything like that. We can also take some blood tests if they have any problems with weight loss and things like that. And also, give us a baseline for their health. So if they ever do become sick, we've got a comparison for when they are, when they're healthy. So that's another thing. So there's lots of different things we can do, and doing these regular dental procedures on nice healthy horses means that we can keep in touch with all their health and keep up to date with all the preventative health things. The other thing is making sure they're up to date with their vaccinations. So every year Tia has a 2-in-1 tetanus and strangles booster. So that's something we might also often do at the dentistry exam.